Welcome back to another episode of Community Health Paramedicine. This time we are focusing on Chapter 7, Social Determinants of Health. What are they? We're going to define this for you we move about. Also, if you ever have questions that I have not answered within a PowerPoint presentation, or if I have made you more confused within my PowerPoint presentation, please feel free to reach out to me via my email. I would be happy to follow up. So social determinants of health are the conditions in which people are born, in which we grow, live, work, and in which we age. The World Health Organization, the WHO, reminds us these conditions are shaped by wealth distribution, available resources, and community support system. Here in Western North Carolina, we see how these factors play out every day, whether it's access to healthy food, safe housing, or simply transportation to a doctor's office. Recognizing these determinants help us as community providers. It helps us identify what is really driving our patients' health challenges. One of the most important parts of our role is conducting the needs assessment. We're not just treating the immediate complaint, it goes beyond that. We're looking at what is behind it. For example, a patient calling us repeatedly for breathing issues may actually be struggling with poor housing conditions like mold or limited access to medications. In our region where many counties are rural and resources are stretched thin, identifying these root causes is critical for both individual patients and the health of the entire community. Social issues that impact health can range widely. Some are cultural, like food traditions that influence diet and activity, and others are socioeconomic, like our poverty patients, which can limit every aspect of a person's health. In our region, we often see families who have to choose between paying for medications or keeping the lights on. These real life struggles influence whether patients can follow medical advice or maintain their long-term wellness. As community paramedics, we are uniquely positioned to identify and address these social determinants. We often enter people's homes, giving us that direct view into their environment. Addressing even one determinant can create a domino effect. For example, helping a patient secure employment can provide steady income, which may then lead to health insurance and better access to care. In our area where unemployment or underemployment is common in certain rural counties, this kind of support can change the trajectory of the patient's health. Social determinants should be addressed early and at that foundational level. Think about patients we frequently see with chronic health issues. Rather than repeatedly transporting them to the ER, we can step back, identify what's contributing to their condition, and then educate them. In WNC, we know patients with uncontrolled diabetes or COPD often cycle through EMS calls. By addressing diet, home safety, or access to medication early, we can help break that cycle and improve outcomes. Key social determinants that shape a community's overall health include factors such as religion, culture, socioeconomic status, the age, and relationship status. Each of these influence the way people live, the choices they make, and their access to care, ultimately shaping health outcomes at both the individual and the community level. This slide is just a visual. It's a reminder that social determinants are not abstract concepts. They surround us every day. The images here represent the environments people are born into, the communities they grow up in, and the conditions they live and they work in. These factors are often invisible during a quick EMS call, but they may have a major impact on long-term health outcomes. As community paramedics, our job is to learn how to recognize these hidden influences in our patients' lives. When we talk about health, it's easy to focus on medical factors alone. That's kind of the way our brain is wired. But social determinants remind us to broaden that perspective. Of all the factors influencing health, the social ones are the most fluid. They can change quickly for better or worse. In our region, things like sudden job loss, a closed factory, a washed out road, which we've seen a lot of issues around that, can rapidly shift a community's overall health. Religion also plays a significant role in the overall health of both communities and individuals. A patient's religious beliefs can impact health in positive or in negative ways. For example, many faith traditions promote healthy behaviors like limiting alcohol or encouraging community support, which can improve health outcomes. Historically, religion has shaped public health. For instance, Hebraic practices of circumcision reduced the risk of certain infections, and religious traditions of quarantining illnesses like leprosy were early ways of protecting communities from outbreaks. At the same time, religious beliefs may also influence what kind of medical interventions a person does accept. Some patients may decline vaccines, blood transfusions, or even birth control based on their faith. Others may turn first to prayer as their primary form of healing. Here in Western North Carolina, where churches are often central to community life, faith-based perspectives matter deeply. As community paramedics, it's important for us to understand and respect these beliefs because they directly shape decisions about care, end-of-life choices, and even whether a patient will accept treatment in the first place. Religious beliefs often guide how patients interact with medical care. Some faiths have very specific guidelines about what type of medical interventions are acceptable. For example, a patient may refuse a blood transfusion, decline those vaccinations, as we mentioned before. For others, that prayer is that main go-to for them. This doesn't mean those patients don't value medicine. It means they prioritize their faith in the healing process. It's also important to remember that in our society, every person does have the right to abide by their own convictions. For many patients, spiritual care is just as important as physical care. Religion also strongly influences the end-of-life decisions. Some patients may want every possible medical intervention, while others may choose comfort care or palliative approaches that align with their own beliefs. As community providers, we need to be aware of these factors, not just to respect our patients' values, but also to better understand how those beliefs impact their health and the health of the broader community. In our area where faith communities are a central part of life, this awareness helps us build trust and provide care that meets patients where they are. Culture practices are also important when examining the social determinants that affect a person in the community health. Culture is defined as the beliefs, customs, and art of a particular society, a group, a place, or a time. Our focus will be culture as identified in customs. The culture environment in which a person lives can influence their outlook on life. Today, when food is ever present and easy to access, obesity has become a public health problem. To complicate this unhealthy trend, a person's growing up in a culture that places great emphasis on an unrealistic body size may be influenced to make choices that are not healthy in an effort to fulfill cultural expectations. Things like anorexia or bulimia come to mind. Culture practices include dietary choices. Some cultures cook and prepare foods that are very high in sodium, sugar, or saturated fats. Excessive amount of these elements in food have been linked to increased public health problems, ranging from high blood pressure, cardiovascular disease, to diabetes. Some cultures have a history of healthy food preparation and choices. The Mediterranean diets often have their center foods that include olive oil, nuts, and other foods that reduce inflammation and benefit the body. Culture doesn't just shape our tradition, it also influences whether people are even going to seek help in the first place. In some families, going to the doctor is reserved for when you are very sick, truly sick. Some patients may wait until their condition is severe before even calling for help. In others, regular checkups and preventative care are the norm. Culture also affects how decisions are made. Patients may rely on elders, spouses, or even community leaders when deciding on medical care. Our job is to listen. So listen for these cultural influence. If we respect them, our communication will be more successful with patients, and they'll be more likely to follow through with our recommendations. Socioeconomic status, things like income, education, employment, may be the most powerful of all social determinants. It affects everything: access to food, safe housing, healthcare, and even transportation. In Western North Carolina, many patients live below the poverty level, that poverty line, or they rely on seasonal work, which makes consistent health care hard to maintain. Low socioeconomic status is linked with social exclusion, higher risk of disease, and shorter life expectancy. As community paramedics addressing these barriers, sometimes as simple as connecting a patient to local food or housing programs, can have long-lasting effects on a patient's health. Social exclusion happens when people are left out of community resources and support systems. This can affect groups such as the homeless, people living with mental illness, or those with a history in the criminal justice system. Poverty often pushes people further to the margins, making it harder to access even free health resources. In Western North Carolina, where rural isolation can already limit care, exclusion can be devastating. When patients feel shut out of community life, their health declines more quickly. Identifying and reconnecting these patients to resources may quite literally save lives. Housing is more than just a roof over someone's head, and we know we have a massive housing issue in Western North Carolina. Housing is a primary layer of protection against the environment. Safe, stable housing shields people from the elements and reduces exposures to risk like extreme cold, heat, or storms. In Western North Carolina, where weather can swing from snowy winters to humid summers, housing quality has a direct impact on health. When housing is inadequate, drafty trailers, leaking roofs, or unsafe structures, patients face higher risk of illness and injury simply because they lack reliable protection. Housing also determines access to essential services needed for health. Things like clean water, sanitation, waste disposal, and reliable shelter. Without these, even basic hygiene becomes difficult, leading to higher rates of infection and disease. In our region, many homes rely on private wells and septic systems. When these fail or become contaminated, entire families are at risk. A safe home isn't just four walls, it's a place that supports proper health through water, sanitation, and structural stability. Clean water is essential to maintaining health and hygiene. It allows for proper food preparation, sanitation, and personal cleanliness, all of which prevent illness. Without safe water, infections spread more easily, from common colds and flu to staph and GI diseases. In Western North Carolina, families do rely on those wells or even springs in some situations, and they may face challenges with water safety after floods or heavy rains. For many of our patients, simply ensuring access to clean, safe water can be one of the most important steps towards better health care. Across the U.S., thousands of households still lack basic plumbing and running water. In fact, about 630,000 homes, which is roughly 1.6 million Americans, live without adequate access to these services. Here in Western North Carolina, older rural housing in remote mountain areas make this especially relevant. Patients without running water face daily obstacles to health, and these gaps can explain why chronic illness or infections keep reoccurring. Recognizing these situations during home visits helps us connect patients to resources they might not even know exist. When we enter a patient's home, we're not just guests, we're assessors of health as well as safety. Common causes of injury we should look for include those trip hazards, poor kitchen safety, inadequate lighting, and a lack of grab bars in the bathroom. This isn't about judging how someone lives, it's about identifying preventable risk. For example, a loose rug or poor outside lighting could be the reason an elderly patient keeps falling. The simple observations during a home visit can prevent repeated calls and hospitalizations. Some homes pose serious health risks. Dust, mold, lead paint, cockroaches, rodents, they all worsen chronic illnesses, especially respiratory diseases. Patients with COPD or asthma may never improve if they remain in these environments. In our region, we see this in both older houses and low-income rental properties. Recognizing these hazards allow us to connect patients with housing assistance programs or local health departments, which can address issues far beyond our scope as EMS, but essentially it'll help the patient's recovery. Education is one of the strongest predictors of health. People with more education are more likely to have stable jobs, health insurance, and a longer life expectancy. They're also more likely to adopt those healthy behaviors that we are trying to establish. But even health education alone can be transformative. Teaching patients how to manage their conditions, like monitoring their blood sugar properly, or even taking their insulin correctly, and understanding diet can prevent repeated emergencies. In our area where many patients may not have advanced schooling, simple health education during visits can empower people to take control of their care. Employment is also closely linked and often associated with the educational social determinant. Being employed can have a positive impact on a person's overall health. For most of us, people who are employed often find themselves further up on the social ladder, which tends to positively impact their overall health condition. Employment also improves people's likelihood of having access to healthcare services and resources. In Western North Carolina, many of our residents work in farming, construction, or manufacturing. These are physically demanding jobs and they take a toll on the body. On the other side, unemployment or underemployment leads to worse outcomes, depression, limited access to care, and even premature death. As providers, we can't change the economy, but we can help patients connect with resources that reduce the health impact of job loss. Transportation is often overlooked, but it is a major determinant of health. Lack of public transit in Western North Carolina means many patients struggle to get medical appointments or pharmacies. Without a reliable ride, even free clinics are out of reach. When we think of transportation as a social determinant of health, we are focusing on the role that transportation plays in affecting our environment. Increase in motorized transportation leads to decrease in manual transportation, means people walk less. Walking to the grocery store or to the nearest bus stop to use public transportation does increase the level of physical activity in a country where obesity is on the rise. So that's the flip side of the coin. Transportation systems also have an effect on the cost of goods and services. For people on fixed or very limited income, any increase in the cost of goods and services can have a negative effect on their ability to maintain a diet that supports their proper health. Increases in food prices have even caused some families with low and mid-level incomes to fall into the poverty end of the social gradient. When people fall into this end of the social gradient, not only is their health affected due to poor diet, but they also enter into the arena of health risks caused by poverty. This is a prime example of the extreme fluidity of the social determinants of health. Age plays a central role in health. Infants and young children are at higher risk for infections, while our older adults are more likely to face chronic diseases and mobility challenges. Both groups are often dependent on others for healthcare access. Western North Carolina has one of the oldest populations in North Carolina, which means our EMS system sees a high number of falls, strokes, and age-related emergencies. As community paramedics, we must consider age when planning care, whether that means vaccination outreach for children or home safety assessments for our active agers, as I like to call them. Relationship status also affects health outcomes. Having a spouse, a partner, or strong support system often means better access to transportation, medication assistance, and their overall care. Married or partner households also benefit from combined incomes, which can help with insurance and basic needs. But support goes beyond marriage. Friends, extended family, and faith communities can all be vital safety nets. In rural Western North Carolina, where many patients live alone or far from relatives, social isolation is a major risk factor. Recognizing who our patients can rely on and who they can't helps us plan care that truly fits their own unique situations. Social ecology is the field that developed in the 1960s and the 1970s to explain how people's environment affect their health. It reminds us that health is not just about biology. It's also about those social interactions, relationships, and community structures. As community paramedics, we gather this information through patient and community needs assessment, which all of your communities have done before they started building their programs. This gave us an insight on how these social factors help shape health outcomes. So kind of like medicine, when all of our systems are connected, the same is true for this as well. The social ecological model looks at 4 dimensions of interaction: the individual, their close relationship, their community, and society as a whole. When we use this model, we get a full picture of how someone's health is shaped, from their personal habits all the way to national policies. For us in Western North Carolina, this means recognizing not just the patient in front of us, but also their family support, the community resources, and larger social pressures. At the individual level, we focus on the person's environment as well as their history. We ask questions like, what chronic conditions do they have? What's their diet like? Are their culture or religious beliefs affecting their care? At this stage, our interventions are often about education, helping patients understand their condition and how to manage it. For example, teaching a diabetic how their blood sugar impacts their overall health can make a life-changing difference for them. The second level is the person's relationship. Here we look at family, friends, and close social networks. Are these relationships supportive, or are they sources of stress? Are family members helping with their medications or helping make health decisions for the patient? At this level, our interventions might include counseling, educating family members, or empowering patients to take more control of their health. Strong relationships often mean better outcomes for our patients. The third level is the community. This means looking at the patient's broader environment, their school, workplace, neighborhood, and community groups. Does the patient have access to healthy food, safe housing, support programs? In a region, this might mean contacting isolated adults to Meals on Wheels, or helping a patient engage with a local senior center. Community level interventions often prevent isolation and improve the quality of life. The fourth level looks at societal influences. Here we consider cultural norms, stereotypes, and policies that affect health. These are pressure that one person can't control alone. For example, stigma around mental health can prevent people from seeking treatment, and state-level healthcare policies affect access to services. At this level, community paramedics can't fix the problem alone, but we can advocate for patients and connect them to resources shaped by policy. By using socioecology, we see how all 4 levels, individual, relationships, community, and society, interact to shape health. For example, if we notice a group of patients with high blood pressure who also follow a high sodium cultural diet, we can identify that as a community level issue. We might then partner with local resources like nutritionists or public health programs to address it. This holistic approach makes our interventions more effective as well as sustainable. Health isn't only shaped by social factors, it's also shaped by physical environment. Environmental determinants include things like air quality, water quality, housing, and climate. Globally, nearly a quarter of all diseases and death are linked to environmental factors. In Western North Carolina, where flooding, landslides, and older housing are common, environmental conditions directly affect our patients' health. Environmental determinants include that air quality, water safety, urban degradation, and climate change. Poor air quality increases that risk of asthma and COPD, both of which we see frequently in this region and have multiple calls a day within our agencies. Climate-related disasters like flooding and wildfires, which we have seen more than our fair share of, are not uncommon in the mountains, as we've seen. Also create health crises that can last long after the immediate event. Many of our small communities are still rebuilding, and it's been almost a year since the hurricane came through. Children are especially vulnerable to environmental risk. Living near highways, industrial areas, or using wood heat in poorly ventilated homes increase the risk of developing asthma. In our region where many families rely on wood stove, I do, love mine, and live in areas prone to mold or dampness, these risks are real and visible. Recognizing environmental contributors allows us to connect patients with agencies that can help improve their living conditions. When we conduct assessments, we should always look for environmental risk. Is the patient's home near a polluting industry? Are there signs of an unsafe housing like drafty walls, mold, lead paint? Is their water source reliable and clean? Documenting these observations not only help individual patients, but it also gives us data to advocate for community level improvements. Documentation is more than just a record of a visit. It's the foundation for treatment, planning, and program improvement. Each time we document, we create evidence that can show what's working and what's not. Strong documentation also provides the platform for grants and for funding. If we can demonstrate through data that EMS is repeatedly called to the same patient's house because of poor housing or lack of transportation, we can make the case for community investment in those areas. Public health policy addresses social determinants at both the local and the national levels. Locally, this might mean safe sex education, free blood pressure screenings, or nutrition classes. Policy levels enforce or efforts include keeping physical education in schools, expanding school meal programs, and providing drug education. Each of these initiatives tries to reduce disparities before they become emergencies. On a broader level, policies like employment benefit or low-cost healthcare clinics aim to reduce health disparities for entire populations. The Affordable Care Act, for example, was designed to expand access to care for millions of Americans. While not every policy is perfect, they remind us that health is deeply tied to the systems around us. As community paramedics, we need to stay aware of these policies because they shape the care of our patients and what they can access every day. This chapter reminds us that health is about far more than medicine. Social, economic, culture, and environmental factors often determine whether our patients can get better or whether they keep calling 911 for the same problems over and over again. In Western North Carolina, we see these challenges every day. Patients without transportation, families choosing between medicine and groceries, older adults isolated in rural homes, and communities hit hard by poverty or disaster. Our role as community paramedics is to bridge the gap. By recognizing and addressing social determinants of health, we don't just treat emergencies, we prevent them. We help patients break cycles, improve long-term outcomes, and build healthier communities. That's the heart of this work and what it's all about. That's all I got for you with this presentation. Hope it was helpful. Stay safe.